Advanced care planning is a key driver in end-of-life care. It's designed to give patient a control that disease otherwise taking away. As someone looks into the future and contemplates their deterioration with the possibility of losing capacity, it gives back some sense of control that perception is removing. Research has shown time again that the more control that someone has over the situation, the better the health outcomes in all circumstances. Advanced care planning is everybody's business. It has to be, because unless health and social care staff are discussing advanced care planning with patients, families, how do they know that it actually exists? So if someone says, whatever happens, I don't want to go back into hospital, it's a cue that someone should pick up and say, have you thought of making a plan so that some of those things that you're thinking, feeling at the moment can be put into place. It's not role specific, but skill specific. So I'd say if someone is faced with that cue, they can pick up that conversation, and within that conversation, the person may be faced with questions that they don't really know the answer to, but it doesn't impede the discussion taking place. It's just at that point saying, as regards that, I can't really answer at the moment, but I can invite someone who'll be better equipped to deal with that. So it doesn't actually impede the discussion. A statement of wishes and preferences can cover all aspects of care, medical and non-medical, and in the role play example you see that the nurse discusses all aspects of care, which gives someone a sense of control over everything that they're likely to face in the future. The example also shows how the nurse carefully discusses and differentiates between a treatment designed for comfort and one that is designed to prolong life, so that people are entirely informed about the treatment options that they are making. I say it's not role specific, but skill specific. Though there are competencies for advanced care planning discussions. So someone needs to demonstrate an awareness and understanding of advanced care planning and the times at which it would be appropriate. Demonstrate awareness and understand the legal status and implications of advanced care planning process according to the provisions of the Mental Capacity Act 2005, because the Mental Capacity Act means that advanced care planning has legal status, show understanding of informed consent, and demonstrate the ability to give sufficient information in an appropriate manner. So that does mean that we need to use effective communication skills when having advanced care plan discussions as part of ongoing assessment and intervention. We need to work sensitively with families and friends to support them as the individual decides upon their preferences and wishes in the advanced care planning process. Always remembering that family and friends may be included, but only should the individual wish. Where appropriate, ensure that the wishes of the individual as described in the advanced care planning statement are shared with permission with other workers. There's no point having a plan that no one is aware of, because how can your wishes be met? When appropriate, know what the advanced care plan statement contains and how this will impact upon an individual's care delivery. The professional should be able to identify the patient's concerns, those things physical, environmental, so place of care, who they want to be with them, so social impact, psychological, what it means to them, what thoughts they have about care, what is important, what are their priorities for care, and those spiritual concerns related to advanced care planning. The professional should be able to recognise cues which indicate the patient is becoming distressed. So if you recognise that, a simple statement of, would you like to leave it now, and we can return to this at a future time when it's more appropriate for you. But the professional should main the conversation with trust and respect. Explore issues before offering a response. Always ensure that the patient is in control of this discuss facts, know his or own limitations. Again, it doesn't impede the conversation, but at some point it may be, I can talk to the wider team and get someone to come and talk in more depth regarding that issue. Revisit questions, and then offer feedback from colleagues if that is appropriate. So the steps in document the conversation, which you'll see in the example role play: drop a draft document, review the document with the patient's agreement, share with individuals, e.g. family and other professionals, amend and redraft as appropriate, sign and set a review date, and then disseminate to key individuals. So, during the process, the professional should get the facts, understand the person's condition and prognosis, find out from the patient how they see the situation, what is their understanding. The starting point is always the patient's perception. Be aware of local resources, e.g. hospices, care homes, community services, etc., so that it is an informed conversation. Choose a private environment. Allow adequate time for the conversation. Establish who the person would like present at the conversation, if anyone. Ensure good communication skills are used. And that is really inviting the patient to vocalise any concerns or issues they have, and explore them to clarify what they mean to them. And it's really about active listening. Respond to its communication style and build rapport. And remember to maintain an individualised approach. Encourage the person to remain in control of the conversation. It is about them and solely about them. The patient should be encouraged to think about their preferences for care, prior to engaging in the advanced care planning conversation. And the health professional should reinforce this by stating their role to assist in making decisions if required. This process is one of facilitation, not of taking it over. Many patients are not aware that they can and should participate. So, for example, it is important that you think about any preference that you may have, so we can discuss these and perhaps help you make decisions. And you'll see this in the role play example. Initiating discussion. The meeting should be planned. As I said earlier, it may be that it's been prompted by statements that people have made. So you're responding directly to someone's concerns and now putting it into a more formal structure. The patient, whoever they wish to be with them, if anyone, should be aware of the purpose of the meeting. During the meeting, the health professional should be clear and again reiterate its purpose, and the health professional should establish the patient is still happy to go ahead after having had a couple of days to further think about it. So a direct question to the patient enables the health professional to assess whether or not they are still ready to go ahead with the conversation. So it would be good to discuss what kind of medical care you would want if you should get sick again. How do you feel about talking about this now? Other possible openings? What do you see happening with your illness over the next few months? It would be good to discuss what kind of medical care you would want if you should get sick again. How do you feel about talking about this? It is important that you think about any preference that you may have, so we can discuss these and perhaps help you to make decisions. Sometimes people in your situation felt it is important to let the staff who care for them know their wishes and preferences regarding future care. Have you had any such thoughts? For some patients, control is vitally important. So if you're aware that is an issue, in view of your recent admissions to hospital over the past weeks, I wonder whether you may now like to think about having some discussions about your future care. Often patients who like to remain in control of their care bend from having such discussions and formulate an advanced care plan. Is this something you'd like to consider? Or, I think we agree that you're becoming more poorly. I know remaining in control of your care is important for you. Would you like to consider creating an advanced care plan? This could be of real benefit to you at a time when you perhaps don't have the energy or mental capacity to express your wishes, preferences and concerns. Often people like yourself who like to manage their care choose to write an advanced care plan to assist professionals to deliver their care at a time when they become too ill to best advise on their wishes and preferences. I think this is something you should consider discussing. It would help me to know what your wishes are. When the time might be wrong to start an advanced care plan conversation, when the patient is symptomatic, they'll be unable to focus and may feel the future is more short term. If the patient is angry or upset, they may lack concentration and the ability to think about the future. If the patient has not been informed of their situation or if they lack information, therefore the need to plan ahead has never really been considered. If the patient and or their family are in denial, the patient is not in denial, but is simply not ready to think about a plan for the future. Again, it is about control, and the patient should be able to choose the correct moment. Maintain a conversation built on trust and respect. This will encourage the patient to feel at ease and able to disclose their questions and concerns freely. Allow the patient to lead the pace of the conversation and be in charge of what to discuss and when. Use open questions so they can say as much as they wish. And don't be judgmental. Treat all of their questions and concerns as important and interesting. And always acknowledge their feelings about these issues. How does that leave you thinking? How does that leave you feeling? Explore issues before offering a response. You make sure you fully understand the specific details of the patient's questions and can respond precisely. Don't jump to conclusions and end up answering questions they didn't ask. Use the patient's own words and language to feedback what you think they're asking. Ask them to expand or explain in more detail. Break down any complicated issues into smaller chunks to make it easier to deal with. Summarise the conversation often to check you still understand the patient's issues, and you'll see this in the example role play. So, exploring wishes and preferences, it is helpful to clarify when discussing treatment options or hospital admissions that the patient fully understands the difference between a palliative treatment for comfort and one given to actively prolong life. For example, would they never wish to have antibiotics, or would they accept them if they were given to improve quality of life? And again, you'll see this in the role play example. So the whole process is about giving control that disease otherwise would take away. It's a key driver, and it's everybody's business. So, managing advanced care plan discussions. Thank you.